So I'm Luzzi, and this is Renee, and this is my project on ankle assessment. So first we are going to start out with some questions about pastime and average daily living. So you would ask, like, what is your job? Do you play sports? Do you exercise, and how often? Do you have any hobbies? What are they? And what is your age, just to get a feel of the person. Next we would do the primary complaint questions, which would be like, where does it hurt? What is your pain on a scale of 1 to 10? When does it hurt most, in the morning or in the night, which would give us an indication of plantar fasciitis. Does the pain radiate or tingle or anything like that? And was the pain chronic or acute? And then after that, we would go on to the mechanism of injury, which would be, what were you doing? How did it happen? Was it sudden, or did you hear a pop? Which a pop would indicate Achilles tendon rupture. What kind of surface were you running on? Was it flat, bumpy, whatever? Was there any direct trauma to it? Did you know? And then after that would be the characteristics of the symptoms, which would be like if there was a color change in the skin, if it was swelling, if it's unstable to stand on, what type of pain is it? Is it tingle? Is it dull? Itchy? Anything like that? And then when does it hurt again? Which, plantar fasciitis again. After that would be limitations, which would be like, can you walk or run? Like, does it hurt to do that? Can you stand on your tippy toes? Can you evert it or invert it? Does it feel stiff? Do you have full range of motion? Anything like that. And then after that, for the last part, we would have past history, which would be, has it ever happened before? What happened last time? What were you doing? Like, how long did it last time? Has it been in your family before? Stuff like that, to kind of rule out some different things. So then, after that, we would just get up close and personal and look at the feet. So from the anterior view, we would observe the alignment of the toes. So, I mean, they look pretty good. They're pretty aligned. They're even. From the side, put that foot forward. No. Turn that foot forward. Okay. From the side, we would look for a high arch, flat foot, anything like that. And then, put that back. And then from the lateral view, on this side, we would look for swelling or a prominence of the calcaneus or anything like that. Turn and face that way. From the back, we would look to see if the ankles are aligned neutrally, or if they are slightly turned out just a tiny bit. And then, okay, face the computer and stand on your toes. Okay, and then, sorry, to face that way, stand on your toes. Okay, and then from this, we would make sure that the heels are turned slightly inwards, or valgus, varus, you can put it down. You sit down. And then we would look at the gait to see if there's equal stride length and weight distribution. So, walk to the thing and come back. Okay, so that's all normal, and the feet are within 0 and 20 degrees of external rotation when walking. And then we would observe the toenails for athlete's foot, bunions, hammer toes, claw toes, anything like ulcers, anything. And they look pretty good. They're nice and clean. Can you spread your toes? All right, so there's nothing in there. It's pretty good. can you face that way and put your foot up so I can see the bottom of your foot? So now we look for calluses, plantar warts, or any ulcerations, and those look pretty good. So we're good there. Do that again, actually. So then we would palpate for plantar fasciitis, which would be the little, actually turn the window, that way. Okay, do that again. So you palpate in this little triangle all along the foot. Does it hurt? Okay. All along the foot in this triangle, and that's good there. And then we would palpate the both of the Achilles tendons just to make sure that those are, good and everything. And then the tibial nerve right here, palpate that. Palpate peroneal tendons and anterior ankle to check for tenderness. And then palpate for sesamoid bones to find out if there is a fracture in those or anything. And then we would test for range of motion. Okay. I know, whatever. Okay, sit down. Okay, so we test for range of motion, which for dorsiflexion is between 15 and 20 degrees. And the way that we do that is, can you turn slightly that way? Okay, thanks. Okay, so for dorsiflexion, which is when you bring your foot up that way, it would bring, So we have the goniometer like this at 0 degrees, and then when she dorsiflexes, it goes up slightly to check for that. And then for plantar flexion, it should be between 40 and 50 degrees, and that's when you point your toes, like that. Okay, do as much as you can. Is that all you can do?
As much as I can my toes.
Not your toes, your foot.
Oh.
Dumbass.
You
Okay,
said toes.
so then we would go like this. So it would go from 0 to whatever that is. And then inversion. We would test for inversion or eversion, which would be in between 30 and 35 degrees. Okay, so then we would do muscle testing, which for the posterior tibialis muscle, point your foot again. Okay, try to turn your foot inward, and we would push it like that to make sure that everything's good there. And then we would do the same for the anterior tibialis when the patient tries to evert their foot. So, so we try to resist that, and everything's good there. And then some special tests. I don't know how we're going to do this. We do special tests like the anterior drawer test, the posterior drawer test, apprehension test, Varus test, valgus test, the MTP instability, or Morton's neuroma test. And all of those should check out to be fine. And and that is my presentation. This is the most awkward thing in my life. Still fucking going.
Stop. No, stop.
No, it didn't.